Thank you so much, Valentina, and thank you to the association for inviting me and for flying me all the way from Denmark to here. So we're shifting gears a little bit, trying to talk about how to visualize copper in the body. So we have been, for the last 5 years, working a lot with copper-64, which is radioactive copper. And as you can see, it will decay to zinc or nickel. And that's fortunate for us because then we can pick up a positron that comes out of that decay and then visualize where it's going. And we use a PET scanner for that, and that's the one on the right on your picture, and it will help us, and I will show you some pictures as to what this actually looks like. So we can use this method for both cellular studies, also for studies in small animals like rats or mice, in larger models like pigs, and of course in humans. And so we have been doing this. We didn't invent copper-64, and certainly weren't the first to get the idea of trying to figure out what's going on with Wilson's disease, but some of the earlier methods were quite low in resolutions. The first things that were around were the gamma counters. Later came scintigraphy, where the resolution improved a bit. Then on to PET-CT, where you get the CT signal, which is the anatomical presentation of the body, and then you superimpose the signal from the radioactivity. And then more recently, PET-MRI has come around, giving us kind of the same thing as CT, but in even prettier colors. So that's nice. So, but what could they do back in the day? This is a study from '64 where they took rats and they measured feces, bile, and urine collection of copper, and they gave them oral or IV radioactive copper, and could actually figure out that approximately half of the orally administered copper is absorbed from the gut, and that's still something we tell ourselves once in a while. So further copper absorption was determined to be from the small intestine. Now it looks more like this, and pardon the small figures, we can give this either IV, directly into the vein of the patient or the animal, or we can give it orally. And I've kept these cartoons here for my own, to make sure that I mention which type of study we did. So this is one of our assistants helping the patient into the scanner. We usually eat about 1 to 2 milligrams of copper, and what we need for studies is about 1/100th of a microgram. So it's very small amounts. But when I talk to Wilson's patient about this, and they say, what kind of study do you want to do? I say, I want to give you radioactive copper, and that's typically kind of a hard start of a conversation. Well, and then we get along a little bit later. So we have had no one say no until now, and that's very nice, of course. So first we looked at what does this look like in healthy volunteers and in Wilson's patients and in heterozygotes. And if I can get this to work, I couldn't. Is there a technician here who can click on that thing in the bottom? No? Oh, yeah, please go ahead. So this is well, does it work? No. Well, it would have been a very nice video showing you what happens for the first 90 minutes of when you inject copper directly into the veins. It basically shows all the copper going to the liver. And on the right, you see the graph showing that it does it at the same speed, whether or not you have Wilson's. And this is what we expected, because this has nothing to do with ATP7B, because this is going into the liver, and the problem in Wilson is getting out of the liver. So that's what we expected. So when we look at it a little bit later, you see here a healthy person at 1.5 hours, we can actually see the gallbladder as a sign of excretion. And at 20 hours, you can see the colon, the copper had moved to the colon, whereas in Wilson's patient, it just keeps accumulating in the liver. So we can actually use this method to demonstrate what's going on in Wilson's disease directly using copper. So this is another way of showing the same thing. If you look at the first 4 pictures on top, these are actually Wilson's patients. And if you look at the small arrows, it's the gallbladder, and it's completely empty, as you might see. So no radioactivity there. go to the heterozygotes in the middle. They have a little bit, so it's a greenish color, whereas the healthy controls have a more extensive excretion where you can see the copper has now turned red, or the intensity of the radioactivity has now turned red. So then, of course, now having shown what this does without manipulation, we wanted to see, could we use this to evaluate what happens with some of the compounds that we use for daily practice? The first study we did was a zinc study. And we took 40 healthy individuals and randomized them to 2 types of zinc in 2 different doses, and said, could we then see the efficacy of this using our method? And for this, because zinc blocks copper absorption, so then we gave these subjects radioactive copper to drink. So we made a very tasty orange juice with radioactive copper. And so this is a before and after picture. So this is before 4 weeks of treatment with zinc and after 4 weeks of treatment with zinc. And as you can see, there's a substantial difference. When you quantify it, we end around a 50% reduction of hepatic copper uptake. So we don't block the uptake of copper completely when we use zinc, but we block it to about an extent of 50%. But look at the error bars on this. So some patients have, or these are healthy subjects, some of these have very, very good effect of zinc, and some don't have as much effect. And these are actually comparable data to the old Brewer studies done years ago. So moving on to other things, of course, what else in the copper? We have penicillamine and trientine, and we've known for years that the urinary excretion on trientine is lesser than on DPEN. And we thought, well, maybe this was because trientine could chelate directly in the gut, so that not only does it work as a urinary excreter, as we all know, but maybe also, not to some extent, to block the uptake of copper, like we just shown for zinc. And this is actually exactly what we saw. So trientine works at approximately the same, with approximately the same efficacy as zinc in blocking copper uptake from the gut. So we're not the only ones who have tried to use this method. So this was a paper from Vivet, who did the gene therapy, and this is a mouse study where they actually could see biliary excretion using the radioactive tracer after the introduction of the vector with the gene therapy in a mouse model. But as you all know, mice are not men, and unfortunately not all mice data translates into something we can use in humans, and now the program has been discontinued. But this was some of the data that led them to move on with their studies. So we're of course also interested in evaluating other or newer therapies. This is methanobactin, which has been investigated for some time preclinically now. It's not yet entered human use. So what can we do? We can use pigs. So this is I think a very nice picture of a pig for 90 minutes. So what you see here is you inject copper directly, and if you know pig anatomy, you will know that they have big veins in their ears. So we use a vein in the ear for injection of radioactive copper. And what you can see is that after 90 minutes, a lot of the copper has gone to either the liver and the kidneys. But these are healthy animals, so they should, in theory, begin to excrete at some point. So what we did was we then bound methanobactin, which is this new compound, a powerful chelator, to radioactive copper outside of the pig. And then we did the same thing again. So just to see what happened. And here you can see that this thing, methanobactin with radioactive copper combined, then simply within the same time frame just raced through the liver. So already at 60 minutes, most of this had gone to the small intestine, indicating that this, when combined methanobactin plus copper, these use completely different transporters for uptake and excretion in the liver. And we've actually also shown this in Wilson rats, that it goes directly through the liver to the bile. So this is really promising for this new compound that I hope we're going to hear more about in the future. So in conclusion, I hope I've shown you that we have learned a lot, and we find these studies using copper isotopes very useful for special case diagnostics. for human and animal studies of copper metabolism, and also for the evaluation of specific, both existing and newer treatments. And these are some of the people that have helped me do all this work. So Peter, my mentor, in the middle, the elderly guy, and the rest are the PhD students. So thank you so much for your attention.